Hello everyone and welcome to our module on developmental milestones. Developmental milestones are motor, language, and social skills that children acquire at various ages. And so if you know these milestones, you can evaluate a child, and based on his or her age, there are certain skills that the child should have. If those skills are missing, this is called developmental delay. Developmental delay is a failure to reach one or more of these milestones. And developmental delay has a large differential diagnosis. There are some causes of developmental delay which are reversible, things like hearing loss or lead poisoning. These can be treated. There are also causes that are not reversible. Many of these have to do with genetic abnormalities. The developmental delay occurs together with dysmorphic features, meaning that the face, limb, or other parts of the body are abnormal. So for example, children with Down syndrome can have developmental delay. Children with Fragile X syndrome can also have developmental delay. This is part of the larger genetic disorder that these children have. The developmental milestones are broken down into categories, and I've listed some of the important categories here on this slide. And within each of these categories, there are dozens of milestones as far as what a child should be able to do at various ages, ranging everywhere from birth up to 4 or 5 years old. It's not necessary to memorize every single one of these milestones. What you want to know as a medical student are the most important milestones so that you can quickly evaluate a child and determine if that child's abilities are appropriate for his or her age. And so that's what we'll go through in the next few slides, the major developmental milestones and what you should know about each one. Let's start by talking about the gross motor milestones. The way to remember the developmental milestones for gross motor function is to remember that the goal of the first year of development is to learn how to walk. Most children acquire the ability to walk at around 1 year of age. It's not always exactly at 1 year. Some children are early, like 9 or 10 months. Some children it's later, like 13 or 14 months. But at approximately 1 year, that's when most children learn to walk. If you can remember that the goal of development is to be able to walk at 12 months of age, then it's easy to remember that the developmental milestones before 1 year of age are all things that you have to learn to do first so that you'll be able to walk. And the way I've always remembered these developmental milestones at 2, 4, 6, and 9 months of age for gross motor function are to picture a newborn baby who is lying face down. That baby wants to learn how to walk by a year of age. So how is this going to occur? Well, the first thing the baby has to do is lift its head, and so that's what happens at 2 months of age. The next thing the baby has to do is roll over because the baby's on its stomach and it needs to roll over so that it can sit up. And so rolling over usually happens at about 4 months. Once the baby rolls over, it needs to sit up. That occurs around 6 months. And then it needs to crawl, pull up, and then stand, and this occurs around 9 months. So just picture a baby like shown in this picture here. That's the newborn baby. Over the course of the first year, it's going to go through all these steps until finally at 1 year it can walk. And that's how you can remember the developmental milestones for gross motor function. Another easy way to remember it is to know the rule of thumb, that it proceeds from the top down. Babies acquire gross motor skills for the head before the legs. That's why lifting the head is one of the first things to occur. One of the last things to occur is standing and walking. So that's gross motor function. Now let's talk about fine motor function, which involves the development of the ability to use the fingers and hands for fine motor functions. And the goal of the first year in terms of fine motor development is for the child to acquire a pincer grasp and the ability to throw objects. This is a child pinching a leaf between his thumb and fingers. That's evidence of the pincer grasp, which most children acquire the ability to do at 1 year. So if you know that the goal at 12 months is to acquire a pincer grasp and the ability to throw objects, then it's easy to remember that the developmental milestones before 1 year are all steps along the way to having that pincer grasp and throwing ability. And the way to remember this is to think of a newborn that has his or her hands in fists. That's how many babies hold their hands. They're going to gradually over the first year learn to switch from that position into having a pincer grasp. So at 2 months of age, the first thing babies learn to do is how to open their hands up and press their hands together. At 4 months, they can grasp a rattle. This is sort of a clumsy grasp that uses the entire hand. At 6 months, they're able to transfer objects from one hand to another. At 9 months, they have a 3-finger clumsy grasp. They also like to bang things like 2 cubes together at 9 months of age. And then finally, at 12 months of age, they get the pincer grasp and they start throwing objects. In terms of language and communication, the goal of the first year of development is to acquire the ability to say one word with meaning. So 1-year-old babies can say things like mama and dada, and they know what those words mean. They say them as they are pointing to their mother or father. It's always important to remember for your board exams that normal language and communication development requires hearing. So a baby that is progressing normally in many areas but not in language or communication may have a hearing problem and need a hearing test. So if you know that the goal at 1 year of development is to be able to say mama and dada, then it's easy to remember that the milestones before 1 year are all steps along the way to saying mama and dada. So a 2-month-old baby can coo, a 4-month-old baby laughs, a 6-month-old baby will begin to babble, and then a 9-month-old baby will say words like ma 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 and ba ba ba, but they don't have any meaning. And then finally, around 1 year of age is when babies will start to say things like mama and dada with meaning. Social development proceeds as shown on this slide. 2-month-old babies smile at people, but they usually don't smile spontaneously. That comes later at about 4 months of age. At 6 months of age, babies can recognize faces, and this is when they can develop something known as stranger anxiety, which I'll talk about in a minute. 9-month-old babies wave bye-bye, and they develop a different kind of anxiety called separation anxiety, which we'll also talk about in a second. And then at a year of age, babies are usually able to point at things that they want and at other people. So let's talk about stranger and separation anxiety. Stranger anxiety is when a baby becomes upset when an unfamiliar person approaches them. And this occurs around 6 months because at 6 months of age, babies begin to have the ability to distinguish faces from one another so they can identify a familiar person like their mother or father from an unfamiliar person. And unfamiliar people can evoke anxiety and the baby can become upset. Separation anxiety is something different. This refers to the baby becoming upset when separated from his or her parents, and this occurs later than stranger anxiety at about 9 months of age. And the reason this doesn't occur until 9 months of age is because the baby has to first acquire something known as object permanence. So object permanence refers to the baby knowing that an object exists even when it is out of sight. Babies younger than 9 months usually do not have object permanence, and so they think that when an object is not in front of them, that it does not exist. In other words, when their mother and father leave the room, they think that their mother and father no longer exist, and then when they come back in the room, they think that they exist again. But once they develop object permanence at around 9 months of age, they start to understand that things that are not in front of them still exist. They're just out of sight. And that's when they can begin to become upset when their parents leave the room, and that's called separation anxiety. This is also why 9-month-old babies start to wave bye-bye, because they understand that people that are leaving the room are still going to exist, just in another place. Okay, now let's talk about some of the developmental milestones for older children, and we'll start with 2-year-olds. And most of the milestones for 2-year-olds have the word 2 in the name of the milestone. For example, children who are 2 years old can run and climb 2 steps. They speak with 2-word phrases, and they can follow 2-step commands. For example, if you ask a 2-year-old to give me the ball and then get your shoes, they can follow this 2-step command. 2-year